Good afternoon, everyone, and thank you. Thank you so much for joining us for our first subcommittee meeting for the Health and Human Services Committee of the Shelby County Public-Private Nonprofit Alliance. My name is Eli Cloud. I am the Executive Director for Thistle MB, and I am one of the co-leaders along with Dr. Judy Martin.
Hi, and I'd like to say hello to you all. I'm so pleased that you all have viewed this as important. We know that what you all do is just critically important for this community and for the people that live in this community. And we're excited to be able to work with you all to try to help facilitate the work that you all want to, to try to help to advance what you all are doing. So thank you for joining us today.
Judy, do you want to talk about the committee goals, or can I talk? You want me to talk about them?
Why don't you just go ahead and get going?
I'll jump in the committee goals, and maybe if you want to do the meeting goals, but guys, just for the sake of everybody's time, I'll share that the goals of our committee today, we want to build a stronger, more connected sector between the health and human services and then nonprofit and public. We would like to bring nonprofits to the table to create goals for this committee. And then our goal is to better coordinated services for residents ultimately, is how can we help people better together?
Absolutely. And then when we look at the meeting goals, we want to, and I apologize, I hate to put the glasses on, but let me just do it. We really want to help to generate ideas for our goals collectively, the goals collectively for Health and Human Services, to identify any barriers to our success as organizations, to identify barriers to the residents we serve as we serve them to get their needs met, and to get good coordinated health and human services in place. So we hope that makes sense and that resonates with your thoughts as well.
And I will say, we have Janet is with us today, Janet Lowe with Shelby County. And then we have Juanita with Momentum, who is our Momentum nonprofit partner leader for this committee. And our sector, and we have 4 subcommittees for this effort. There are 4 subcommittees. Each committee is charged with creating 2 maintainable or achievable goals over the next calendar year. And so that's going to come down to a total of 8 goals that the county and nonprofit sector can work together to accomplish in the next year. So ultimately, that's the goal, is to bring together the goals with the other committees. But part of that process is to receive input from everyone who's in this health and human services sector, so we can determine what goals together we want to work on this year. And I will say we are going to go into breakout sessions. I hope everyone has the agenda at hand, but we will be going into breakout sessions where everyone will have an opportunity to answer 3 questions. It's, what's blocking you, what's blocking your clients, and what is preventing people from accessing your services.
All right, I'll go into my part next. Hi, everybody. I'm Janet Lowe. I'm the manager of community partnerships with Shelby County Government, and I have the privilege of seeing all of you today and working on the nonprofit committee as a whole. And so what I'd like to do, and we are, by the way, later, before we go into the breakout rooms, going to do introductions for everybody. But we felt like it was important to give everybody on a same level playing field and give you all some context behind the nonprofit committee as a whole first. So I'm going to share. Here we go. Let's see if this will work. Okay. All right. Can you all see this?
Yes.
All right, great. So the Shelby County Nonprofit Committee really was born about through the work of the nonprofit sector. So there was a Mid-South Nonprofit Alliance who did this incredible State of the Sector report for 2018. And then of course we have Momentum, which are integral thought partners and throughout the nonprofit committee. And everyone was really expressing that there was a need for a formal forum to work between the nonprofit sector and county government to really strengthen coordination and communication and partnerships between yourself as a sector and between the nonprofit sector and the public sector. And so this is the structure that we developed. I should also say, I forgot to mention, so I am with Shelby County government, but I've only been in the public sector for 2 years. And I worked in the nonprofit realm for 20 years. So I should also say that I'm very connected to the nonprofit sector, which is why I think I'm really particularly excited about this work. I also have the privilege of being in the Office of the Division of Community Services and the Office of Community Engagement and Outreach. And so this particular subcommittee in Health and Human Services brings so true with the work that that Alex and Quinn and I, the team that you'll meet also today, are doing with our daily work. So many of you I can see are some familiar faces, and I'm really looking forward to working with those who are new. So the structure we came up with for the nonprofit committee is here. So we've got over 160 nonprofits participating in this. As you all well know, this was a very inclusive process. If anybody knows Mayor Harris and Director Dorcas Griffin, this has to be inclusive. So we wanted to make sure that any nonprofit in Shelby County who wanted to join could join. We did make the process so that every nonprofit had to choose one representative, and that representative chose one subcommittee. One, because we are already having large numbers within each subcommittee. We didn't want it to get into the hundreds and multiple hundreds. So we had to limit it in some capacity, but we also like the way that it gives a voice to smaller nonprofits that maybe were having a hard time getting access to public officials or whatever some of the decision making was done at the county level. And we wanted to make sure that that representation was also equal. So we're really excited about this structure. As you can see, and as Eli mentioned, we have 4 subcommittees. There's Art and Culture, Children, Youth and Education, Workforce Development, and as you well know, Health and Human Services. These are the leads. So when possible, there was a lead from the public sector and a lead from the nonprofit sector. And that was done intentionally to make sure that even from the leadership standpoint, we were already working in tandem. So from Art and Culture, you can see Lauren Kennedy and from Urban Art Commission and Amber Hamilton from Memphis Music Initiative. This is the outlier though, because Art and Culture does not have someone from the public sector side. So they are both nonprofit representatives. For Children, Youth and Education, we have Dr. Cedric Gray. I'm missing the K in his last name. I'm just realizing now. It's Dr. Cedric with a K, Gray, from the Office of Education and with Shelby County Government, and Cardell Oren with Stand for Children. For Workforce Development, there's Harold Collins from the Office of Reentry and Kyla Guyette, which is with Workforce Mid-South. Workforce Mid-South was formerly the Workforce Investment Network and is now a nonprofit, Workforce Mid-South. And Dr. Judy Martin and Eli Cloud have already introduced themselves as the leads from Health and Human Services. Those rep leads joined together to form our leadership team. Mayor Harris and I chair the leadership team meetings. We are joined by Dorian Spears. I'm not sure if she was able to join us today, but she's from Momentum Nonprofit Partners. It's incredible and really helped us develop this structure and our goals and objectives as well. And we have a Momentum partner on each of the 4 different subcommittees as well. And we have the privilege of having Juanita from Momentum with us today on Health and Human Services. And so I just wanted to show you also where all of you are coming from. So the 161 nonprofits that joined, as you can see on the left, really are reflecting a wide swath of the county, which we're very pleased with. Would I like to see a little more in Arlington? Yes, I would. But I think in general, we have done you all have done a good job of coming here so that we all can really get a good capture of what's happening across the county. And the one on the right is where your main office locations are. I have to tell you, as I'm sure that you all well know, that this is an advisory body. So it's not going to hurt, it's not going to be a pro or a con that you're a part of this committee when it comes to, going for funding with the county. This is not going to work for or against you. But what this is an advisory body. And we really hope that we get your input so that as we make decisions in the county, that we can factor in the voice of the nonprofit sector from all of you. But membership or participation at any level on or with the Nonprofit Council doesn't affect the ability or likelihood of receiving any government funding. So one of the things I wanted to stress with all of you is that, yes, this is sort of new for Shelby County, but this is not new nationally, meaning there are models for this kind of work. There are, much larger cities, for example, Denver, New York City, there's a state model from New York State, Philadelphia. There are models in which there are these sort of nonprofit public sector forums. And so we would be remiss to not investigate them a little bit. And so I wanted to sort of just share with you some nuggets because a lot of nonprofits were wondering, well, what could we possibly get out of this, right? Out of this work. So Denver's Office of Strategic Partnerships is a really interesting model. They have done a lot of work in capacity building. They've done a lot of work to streamline the contractual processes between nonprofits and the county. They have a wonderful gateway system, this online gateway system that sort of serves as a combination of momentum and this nonprofit committee, in the sense that it provides great professional development opportunities. They sort of have the finger on the pulse of what's happening in the nonprofit world nationally and transmit that data and information to the nonprofits. And they really do a lot of just advocacy on behalf of the nonprofits in Denver. But I think what's also really unique about Denver is they really worked on identifying nonprofits that were sort of model organizations, and they worked on figuring out what was really working for them and using them to sort of teach out to other nonprofits. And their whole goal was to increase federal funding coming in to the city and the county. And so they did that by being funding ready. And I thought that was a really interesting model. For New York State, they have an interagency coordinator for not-for-profit services. And they also were really laser focused, zeroed in on streamlining contractual processes, and particularly payment processes. So, many of you might know that sometimes you don't always get your payment from a public sector in a timely fashion. And so they really worked on streamlining those processes for the nonprofit sector. For Philadelphia, they have something that's similar to kind of like the Community Foundation, but it was very specific to the mayor's initiatives. So they have what's called the Mayor's Fund, where nonprofits and the public sector worked together to identify a set of priorities. And then they had funding to back those priorities. And that the agency was also accepting donations as well from corporate, business, private, individual donors, philanthropic efforts, and they were all contributing to the Mayor's Fund, but those priorities were outlined by both the mayor and community working together. So those are things I think are some interesting models for us to look at. However, I'm also possibly even more interested in all of us looking at the local models, which are the COVID Task Force and the Memphis Nonprofits Demand More collective. Because both of those were entities that brought together very different groups, but they were zeroed in on a specific objective and then really outlined very specific suggestions and solutions to move the needle within a short period of time. And I think that I really, really makes sense because I don't need to tell all of you we all have enough meetings. None of us need one more meeting to go to. None of us need to talk and complain about what's going on and then write a report, and then the report collects dust and nothing happens, right? We've all been there many, many times. We don't want that to be this process. And so I really appreciate what's been being done with the COVID task force and the Memphis Nonprofits Demand More, because of their laser focus on one key issue, as opposed to, you know, lots of different issues all at once. And really sort of parsing out not just what they want from nonprofits or county, but everybody said, what can we all do to address this issue? And that's what we're looking for with this committee as well. And then many of you filled out the nonprofit survey. Thank you so much for those of you who did. I did want to kind of share out to you what we learned from all of you. Basically, we asked very, basic open-ended questions, not because it was, we just wanted to have a feel for where you all were coming for before we started this work. And so when we asked you, what did you want this nonprofit committee to accomplish? Surprisingly, actually, to me, was that it was all about communication and collaboration between the nonprofits. That was the priority number one for the vast majority of you. Then followed by working with the county. And I guess that's the part that surprised me, but of course I'm county focused, so maybe that's why. But it really was about how you want to coordinate more and partner more with your fellow nonprofits in a strategic way to identify gaps, share data and resources, but really strategically aligning with your fellow nonprofits, and that you were looking for support from the county in that effort. That was priority number one. And again, priority number two was also to work with the county. And then, of course, no surprise here that funding was also a major issue. So identifying sources, building capacity, and making connections with philanthropic entities was also a big top priority. And then improving access to existing services. So as we all know, looking at all of you here in this little Zoom right now, there are many, many services, wonderful services that are already doing the great work in the county. How can we better get the residents to know about all of your services, and how can the county maybe help coordinate that effort or help in that effort? And then priority issues. So when we gave you multiple choice answers, in the open-ended questions, it was all about coordination between the nonprofits. But when we gave you multiple choice answers to select, funding was then the top priority. So followed closely by the coordination of services, equity, capacity building, and access to services. So, no big surprises, but definitely something to chew on. And, I do want to point out, I think I already said that I come from 20 years in the nonprofit world, and I really do believe that the nonprofit sector you're the believers. I think people who are attracted to nonprofit work tend to be people who are very passionate about their work and tend to be creative problem solvers. And so, we on the county side can always look at a problem and come up with our solutions, but nonprofits tend to see those problems and come up with different solutions than we would have thought of. And so I think that that's why it's so important for us to come to you, to get your input and your ideas and coordinate solutions together. So thank you. And I think we can move on.
So I'll just kind of go ahead and jump in now. Thank you.
And I'm sorry, if anybody, I should have asked too, did anybody have any questions? I apologize. Okay, and feel free to use the chat as well.
Great. So thank you, Jen. And again, I'll just kind of take this time now, just kind of jump in and just kind of get people to introduce yourselves. And I'll just say again, because I didn't say much starting out, I am with the Shelby County Health Department. I've been with Shelby County government for 17 years, 17 years, and I work in nursing and allied health. I have always worked in an area where I was working to serve the public and underserved, but I've kind of always been on the education and government side of it. So it's a little bit different from your perspective. So I don't even pretend to be the one that knows. I don't know what your needs are, but I am someone who will help to listen and help to get verbalize what you need and kind of help to get us there. So we can kind of go on with that, and then we're going to start with introductions. Eli, did you want to go ahead and say something else right now, though?
Yeah, I'm gonna just with the introductions, we're gonna go through and try to be short in the interest of time. I think we've got 28 participants on the call, but there are 38 nonprofit committees on this. So basically introduce yourself, your name, the name of your organization, your title, the mission, and then in a couple of words, if you could share the most pressing or burning issue that you're facing. And we can just start like, I mean, who can we call on people? I know we're not seeing the same, we're not seeing the same grid, Brady Bunch grid, I'm sure. So,
let's
Janet,
do it in order of what's showing. Let's start with Juanita.
Yeah.
Juanita, I'm with Momentum, Director of Community Engagement, and I'm just here to support the nonprofits who are a part of this committee.
And I'll go ahead and do me too. So my name is Eli Cloud. I'm the Executive Director of Thistle and Bee. Our mission is to help survivors of trafficking, prostitution, and addiction thrive. And the most pressing issue that I'm facing right now is fundraising.
All right, great. How about Carlene? Would you please unmute, Carlene?
Yes, I guess I need to do that, huh?
We want to hear you.
Hey, everybody.
Hi.
I'm Carlene Leeper with the ARC Mid-South. Our mission is to empower individuals with developmental disability to reach their full potential. One of our greatest challenges, of course, is like I think Eli said, is fundraising and creating more awareness and acceptance in the community, and identifying the various different abilities that people have, whether it's, most people think of disability as Down syndrome and cerebral palsy. So we're constantly creating awareness. I've been with the ARC since 1980 and welcome aboard to welcome that I'm on this committee.
Thank you.
Wonderful, wonderful. How about Frankie?
Hi, everybody. Frankie Dakin, Special Assistant to Mayor Lee Harris, here to support the work of this committee. I guess I will say one burning issue, and I totally get what everybody's saying about how valuable your time is, because one burning issue for us in the mayor's office right now is we just don't have enough time to do to support all the great work that you're doing and folks that are doing around our community. So thanks for having me here today.
Thank you for joining us. How about you, Zach? Zach, would you? Okay, there you go.
Sorry about that. Been on like 8 Zoom calls today. First time I did that today. I'm Zach Pretzer. I'm the president of the Methodist Healthcare Foundation. Super excited to be a part of this group and work with you all. I mean, burning issues in a nutshell is, creating as many strategic partnerships as we can that really address access to quality care and address health disparities in Memphis, in this area. We're laser focused on that. So really looking forward to working with y'all to address that.
Awesome. Awesome. Okay, Kimberly.
Hello, everyone. I am Kimberly West, and I am the Senior Program Coordinator with the RISE Foundation. Our mission is to empower people to become self-sufficient and build by sustaining human and financial assets. So one of the, sorry, I got 2 dogs in the background that are very, very active right now. One of our pressing issues right now, of course, is fundraising and relevancy with trying to change our programming to adjust to everything that's going on with COVID.
Yeah, okay, thank you. All right, Arnetta? Arnetta, would you please unmute?
Hi, I'm Arnetta Macklin with MISA. Our mission is to support the independence of vulnerable seniors and families in crisis through high impact programs. And our most pressing issue is what happens to the seniors and families after December 31st when some of the CARES Act funding expires. Our most pressing issue. Thank you.
Thank
Look forward
you.
to working with everyone.
Thank you. Sally Joyner.
Hi, everybody. I'm Sally Joyner. I'm the interim executive director of Mid-South Immigration Advocates, and our mission is to provide free and affordable quality immigration representation to low-income Mid-Southerners. I would say that our burning word is access to everything.
Good. Yeah, that's a challenge. Thank you. All right, Maureen. Hi. Maureen, would you unmute, please?
Hi, I'm Sister Maureen Greiner. I'm the executive director of the Dorothy Day House. We provide transitional housing and support services for homeless families. We've been operating in Memphis since 2006 and currently are taking care of 9 homeless families simultaneously. I think I would go back to the words that were mentioned earlier, and that's communication and collaboration. Thank you.
Thank you. Kelly.
Hey there, Kelly Henderson, Executive Director at Catholic Charities of West Tennessee. We spent the last 50 years meeting people at a point of crisis, surrounding them with local resources to stabilize and empower them to escape poverty. And we do that through volunteerism as our main driver. And I love following Sister Maureen. She's one of my favorite people in the world. Our burning issue is capacity to meet the growing need, especially around food insecurity and homelessness. I assume we're going to have a lot of overlap there.
Thank you. All right, how about Alicia?
Hi, my name is Alicia Clark. I'm a continuous improvement specialist at Seeding Success. We are a cradle to career partnership seeking to transform systems so every child has what they need to succeed. And I'm just here to make some connections, learn from everybody, and yeah, just connect public and private and nonprofit organizations.
Awesome, thank you. All right, how about Josh?
Hey, I'm Josh Spickler. I'm the executive director at Just City. Our mission is to transform local criminal justice policy and practice to ensure that it's fair for all people, regardless of wealth, race, and ethnicity. Our biggest challenge is just the complete and utter denial of constitutional rights for people in the criminal legal system right now. Courts are shut down, jail keeps filling up, you can't get out unless you have money, no jury trials, and you can get COVID there really easily.
Mm-hmm.
Thank you. All right. Oh, did you say your 2 burning issues, your burning issue?
I mean, the jail and
Yeah.
no access to
fair.
attorneys or courts, or the Constitution is burning.
Got it. Thank you. How about you, Kelsey?
Hi there. My name is Kelsey Hamilton Gibbs. I'm the Chief Development Officer for the Wolf River Conservancy. We are a land trust dedicated to protecting and preserving the Wolf River as a sustainable natural resource. And I would say probably our burning issue right now is competing priorities and projects, just being a small organization.
Okay. All right. Thank you. All right. I see Ben.
Hi, everyone. Glad to be here. My name is Ben Nemanoff, Director of Development for Shelby Farms Park Conservancy, right next door to Kelsey there. And we are a nonprofit organization that manages the 4,500 acre Shelby Farms Park on behalf of the county for the benefit of the public. I think one of our key burning issues right now is, like many parks, we have seen increased visits and park use, actually significantly increased, which of course has put a strain on our ability to maintain those resources and keep those resources in tip-top shape. But like everyone, when funding continues to be a challenge. So That's probably the most burning thing that we face day in, day out.
Great, thank you. And
I think that's me, Ann Mathis.
that's you.
Hey, everybody. I'm Executive Director of the Community Legal Center, and we've been around for over 25 years providing low and no cost legal services, civil services to people of lower income. Some of the work that we do is also for populations at great risk, such as abused elders. We do a good bit of work in that area. So as far as what would be our burning issue, it seems pretty obvious, I guess, to say this, but the effects that have happened so far and we think are going to continue of the pandemic on funding, whether it be fundraising, which is what Eli referred to, but also grant funding. We've had some expected funding that did not materialize or was delayed. And again, I think the pressing needs of reacting to first line COVID needs, whether it be feeding people, whether it be housing people, evictions, that's understandable, but a lot of the needs that we address continue regardless of the pandemic. They may be increased to some degree, but primarily they're the same populations that we've served all along. So that is a real concern right now. So thanks, glad to be here.
Thank you. Michelle?
Hi, everybody. I'm Michelle Lady. I'm the Chief Development Officer at Christ Community Health Services, and our mission is to provide a high-quality healthcare to the underserved in our community. So issues for us are a lot of what everyone mentioned already, but I'll add a new one, and that is employee recruitment, retention, and burnout.
I'm sorry, recruitment and retention, and what was the last word? I'm sorry.
Burnout.
Got it. Oh yeah, okay, thank you. We did not hear from Ramona.
Hi, I'm Ramona Jackson, and I'm the founding president and CEO of the Women's Advocacy Center. Our mission is to support survivors of domestic violence by empowering them to gain economic independence, to form healthy relationships while stabilizing their families and strengthening their faith. We are really faced daily, but particularly now during COVID, with challenges to funding for programming for the clients that we serve. And we really need some kind of transitional and emergency housing for clients that we serve.
Thank you. I don't think did we get to Melanie Keller? Thank you.
I'm Melanie Keller. I'm the president and CEO of Meriton. We're a health and social services nonprofit. We've been in Memphis since 1961. And it's great to see so many familiar faces. I don't get to see you guys in person anymore. But we provide a variety of services from foster care to senior employment. Our mission is to promote independence and well-being throughout life stages with quality and compassion. And our in-home services, skilled and non-skilled, are focused on supporting people with intellectual and developmental disabilities, seniors, and also people that have disabilities related to health conditions and aging. For us, I don't have any new ideas to add. I mean, funding is always an issue, especially for programs like our elder abuse services that don't have a regular funding source. But to echo Michelle, right now it's caregiver recruitment and retention. I worry about my staff because we are providing that in the community support to a lot of people that are COVID positive and very high risk. So everything we do is to mitigate the spread or to provide direct care either through our skilled nursing staff or in-home support. So I worry about PPE. I'm fighting COVID all the time. So it's interesting to me, all of our staff that have become positive have become positive. We have a weekly committee and track our data very tightly, and it's all been related to community association outside of work and nothing transmitted through work. I mean, we test folks and everything, and nobody seems to have gotten it from work. But it's the concern about retaining and keeping my staff healthy, but also that recruitment piece. There's a shortage of nurses, and during a pandemic, it's probably not the most appetizing field to go into, to go into the community and to go into homes during this. So I guess that's also capacity, right? Having enough people to meet the need. So it's been one heck of a challenge these last few months.
A challenge. All right, thank you. Deborah.
Hi, everybody. I'm Deborah Clubb. I'm Executive Director of the Memphis Area Women's Council, and I coordinate the Memphis campaign. The mission of the Women's Council since 2003 has been to give voice to the needs of women and girls, especially here locally and especially around safety, justice, and equity. We work an awful lot around gender violence, intimate partner violence, sexual assault, stalking, and all those sorts of things. I think the burning issue I've been most concerned about through COVID is the difficulty we've had in getting funds together to shift our outreach to people stuck at home, maybe forced to be at home, sheltering with their abuser or aggressor. We need to reach them through television. We need to reach them through social media. And I need an advocacy media fund to do that, as well as, of course, partners who will help with the social media spread of it. But yeah, funds to reach people who are clearly, with the DV homicide rate going up, clearly at risk of their lives right now.
Thank you, Deborah. Ann Langston.
Ann Langston with Church Health. Church Health has been around for 33 years. Our mission is to fulfill the biblical call to care for our bodies and spirits, which is carried out by bringing people across the community together to provide whole person healing. Our population that we serve are the uninsured, people that don't have anywhere else to go. And the greatest need right now is we are slammed. With the large number of people that have lost their insurance or access to care because of the pandemic, we are flooded in our urgent care center and don't have the additional capacity to make those people become established patients. So our high priority is to coordinate with all of our friends at Christ Community and others in the city to see where we can make sure people have access. And then I would join Zach in saying that I think that our other highest priority is coordinating with all of you to make sure that in delivering all those other services that people that are low income, uninsured need in order to be able to maintain their health in more ways than just medically. And my title I left out is Senior Director of Strategic Partnerships. So that's what I spend my time working on.
Thank you. Oh, let's see. Did we get everyone?
I think Kathy Pope just joined us.
Oh, great. Oh, and I see another couple of names. All right, great. So Kathy?
Yes, can you hear me?
I can.
Okay, it's Kathy Pope. I'm President and CEO of Mid-South Food Bank. We provide food to 31 counties. Shelby County is our most in need county. And our biggest challenge is making sure we have enough food in the warehouse to distribute, because we are distributing 3 and 4 times the amount of food in our community compared to pre-COVID days.
Great, thank you. Amaya, did I pronounce that correctly? Okay.
Good afternoon. I'm Dr. Amaya Aratsoki. I'm a professor in the Department of Criminology and Criminal Justice at the University of Memphis. My specialization is domestic and intimate partner violence, and my primary goal as well as need would be to seek out funding to assist partner organizations in doing research to further assist their programming, and to be able to make the connection between practitioners in our community and the research that we do here at the University of Memphis.
Thank you. And Stephanie, let's hear from you.
Yes. My name is Stephanie Lovins. I'm the Chief Operating Officer and Forensic Coordinator for West Tennessee Forensic Services. We have the sole contract with Shelby County to do the forensic evaluations with the defendants who either are suspected to have mental illness. And our biggest issue is the recidivism of defendants who are mentally ill. And also being able to connect them with services in the community. This has been an ongoing issue for quite some time. So.
All right, good deal. All right, who did I miss? Please help me, I'm trying to scroll back.
Introduce myself. I'm Alex Schwartz.
Thank you, yes.
I work in the Division of Community Services with Janet Lowe in the Office of Community Engagement and Outreach. And I've been working on her to organize a lot of this nonprofit committee, all these meetings and taking notes. So you might see my name pop up in your email.
Very good, thank you. We appreciate you too, more than you know. And Quinn, would you please introduce yourself?
Hello, I'm Quinn Taylor. I'm also in the same office as Janet Lowe and Alex Schwartz. I'm an intern and I look forward to seeing what you all are getting into.
All right, awesome. All right, awesome. All right, so we're 2 minutes over time. Thank you all so much though for that sharing. So by my clock, it looks like we might be a couple of minutes over. And so we just gotta kind of get back on track. So you want to come back on board, Eli? I think we're getting ready to do the breakout rooms.
We are. So we are getting ready to do the breakout rooms. If you would, when you get in the breakout room, can we just say that the youngest person in your breakout room is responsible for note taking? We're going to land on youngest person in the group does note taking, and you know who you are if you're in that group. Those 3 questions, we'd like to hear from everybody, which is what is blocking you, what is blocking your clients, and what is preventing people from accessing your services.
Before we break out, I'd like to introduce myself if it's okay.
Of course.
I'm Dolores Claiborne and I am with Catholic Charities Driving the Dream. And I'm here to increase our resources for moving families to self-sufficiency and also to listen in and see what connections I can make in regards to recruitment.
Oh, okay, thank you so much. And I apologize, I missed you. Okay, I'm so sorry.
How are you?
Okay, great. Yeah, welcome, welcome. Thanks to everybody for joining us. And so, hey, we all geared up, we ready?
Yeah.
We ready? Okay.
Into our sessions, there'll be one person that's facilitating from the team, either a Shelby County representative or Judy or myself. But we really want to hear from y'all.
And if I could just chime in too, this is the, we're generating ideas for what the 2 key priorities are going to be for this subcommittee. We can take things from really large, big ideas that we've already been hearing about, criminal justice reform, food insecurity, housing, legal services, all of these big issues that you all have already mentioned. And what we want to do though is have conversations about specific goals that could be achievable within 1 year for these different issues. And however, what we don't want to do is we don't want to focus on stopgap measures. So we do want whatever we do, that it's going to be something that's paving the way towards long-term systemic changes. So for example, we don't want to, we want organizations to get the PPE that they need, but we feel like that's something that's great for the COVID task force. For our purposes, we want to focus on something, maybe it's improving healthcare and nonprofit coordination of materials and supplies. So something that's paving the way towards a long-term change, as opposed to, Band-Aids and stopgap measures that are important. I'm not saying that they're not important, but that's not what we want the focus for this committee to be on, if that makes sense. I just want to put that caveat in there.
back together and share out, and we'll collate all of the ideas that are generated. I don't know if we'll be able to come up with 2 goals by the end of this meeting, but if we can't come up with our 2 goals by the end of this meeting, we'll probably share it out in a Google form for you to kind of rank. But I think, we might have the ability to come back and kind of start breaking some of this down. It's a big thing to take something really big and bring it down to what can we accomplish. And since we have such a diverse group, I think Health and Human Services is spanning a lot of different sectors. Yes.
What is the timeline? What is there a timeline for when Shelby County wants to have all of these 8 goals for working on?
2021.
Sorry?
2021. So the calendar year of 2021.
So basically today or before Christmas?
No, 2021.
That we do our part though, get them these goals before the new year.
We have to get the goals to the mayor by January 28th.
28th. Oh, okay.
28th of January.
So we got to move pretty fast to get concrete, to get to the specific and the concrete, and to narrow down.
And our committee is the 3rd to meet. So the other 2 committees have already met. But our committee has such a varied group across the sector. Health and Human Services really ended up being kind of a catch-all if you didn't fit like perfectly in another group too. It was the default group, I think. So getting everybody on the same page, it's a big task, but I think we can come back at the end of it and try to identify what trended in the breakout rooms. Okay, are we ready to go?
We are. Quinn, can you take us away to the breakout rooms, please?
Yes, but I didn't know if y'all wanted to mention again, Alex has already put the link for the Google Doc in the chat.
Okay.
So when whoever the youngest person is in the group decides that you do want to start taking notes or anything, or if you want to transfer your handwritten notes onto the Google Docs, that'll work, and then everyone can see it like in real time. Alrighty, everyone should.
Pause for 1 second. Quinn, thank you so much for bringing that up. This session is being recorded, but the breakout rooms are not being recorded. So that is why there is going to be a shared Google Doc. So we will all, it's divided into 5 different groups. And so whatever group you're in, you'll have a group number and you'll input your information into your page of the live Google Doc. Thank you, Quinn, for saying that.
Alrighty, everyone should be going
Youngest
over
person.
I don't know if Eli or Judy are back. There's Eli.
Here I am. There's Judy down at the bottom. Okay. I think that's it. Everybody is back. We might have lost 1 person. So how was that for everybody? I mean, do you feel like it was productive? Okay, so we have notes. I saw that notes were being taken, and I think all the note takers, youngsters, you guys are the best. I see Deborah's in the group chat, great conversation in breakout 5, need more convo to get to goal making. And I think that's probably, did anybody get to a goal?
Group 2, we did kind of get to, we kind of got almost, kind of sort of, but it's not fully developed.
Okay.
But it was hard because there are a lot of issues that were being addressed.
So maybe we take a spokesperson from each of the breakout rooms. Should that be the note taker, or do we want to have a volunteer from the groups? I just don't want to hear myself talk the whole time.
definitely not me. A person is already designated from our group.
Okay, great. So group one, do we have a volunteer from group one? I'm looking at you. I'm going to call on somebody. Okay. How about we get Josh on it since we had Kelsey taking notes? Are you cool with it, Josh?
Wow. Yeah, sure. Just highlights, right? Like we're
highlights.
Yeah, there's a lot of talk about resources being thinner and limited these days for obvious reasons. Local funders being tapped out being one of those, the need growing being another. I ranted for a little while about access to certain government services, the postponement of things that we had planned, sort of disruptions of our planning and our hopes for the future. Those are all things that we were dealing with as organizations. We talked a lot about in terms of what's blocking our clients, what's most burdensome on them right now. We talked a bit about evictions and about housing, stable housing and housing security. More discussion about resources. We talked about pivoting toward a language that puts people first, that talks about investing in people primarily instead of programs and infrastructure and things, just people, investing in people. And then preventing, in terms of what prevents access to services for our clients and folks, it's transitions to remote access to resources, which is very difficult for some folks. We talked about transportation in terms of healthcare specifically. And again, I talked about access to courts and clerks being complicated right now by COVID. I don't know, guys, did I do a good enough job there, Eli?
You did a great job. And look, we're running low on time. We ran over. I didn't even see that had happened. So we have the share out. And so what are the actionable items that you will accomplish before our next meeting? And I don't know that we are realistically going to be able to get all of that done in the next 5 minutes. So I think maybe this might be a good time for us to just run through quickly. If we could go to committee 2 and 3 and just say, like, what are the top 2 items that are trending? And then perhaps after we end this session today, this is when Judy and I can get together with Juanita and then collate the data and send a share out. So I know a lot of people will need to process. And so I heard that. I'm a processor. I need to think about this a little bit longer. But if we were to send out a Google form and have kind of a survey and get feedback there and hold down the goals, does everyone agree that they could respond to that survey before the, I would say before a week or five business days? So if you received it on Monday, could we have a response from everybody by Friday realistically?
I see nods.
Okay.
Very good.
Okay.
Very good.
That might be the best step, but can we go to group 2 and see what was the burning issues, what came out?
Okay, well, I represent group 2. So like group 1, we talked a lot about funding. I mean, the magic bullet is more money and more people. I think that's the kind of the universal theme for all of us. Certainly, we'd like more availability of funding, but also we spoke a lot about education, not just of individuals generally, but of the community as a whole, and awareness of the resources that are available in our community and the access or lack of access that our community members have to reach those resources. And so that's going to be one of our actionable items, is to create a universal resource list for distribution.
Okay, and everybody knows about 211, right? because that's just a good resource. 211 Tennessee has all kinds of good, if you're looking for something. Anyway, okay, group 3, can you give us your big epiphany?
Here's our big epiphany, Eli. It is very similar to what's already been said. Technology was really key for the folks in our group. Carlene, Melanie, Ann, and Alex, we talked a lot about people who are needing services who are in remote areas like Shelby Forest, Arlington, Lakeland, etc. How do those people get appropriate teleservices or some kind of remote access? And to do that, the technology needs to be available to them and the infrastructure needs to be there to support that technology. So that was our number 1. Our number 2 was an echo of what's already been said, and that's funding. Funding for staff, funding for operations, funding for wages, funding not for new programs, but for existing programs and the staff to manage and deliver those programs. So those were our top 2. We've got 2 more, and so I'll quickly give those. One was capacity building. That's really important to be able to manage the increase in demand for services during COVID and beyond. And then number 4 was transportation. We put it last because we know that's been a topic of discussion in the county and in the city for some time, not likely to be resolved in the time frame that this group has, but we did want to put that back out there because it is really important that people have an adequate and safe transportation system that gets them to the places they need to get to for programs and services. Thank you.
Thank you. All right, group 4.
I can summarize. So some of the top things, first, just tech access, not having internet, not having devices, and doing everything over tech is making things slower in terms of documentation. Also, like everyone has said, not having enough staff, that's making turnaround slower. Reaching seniors, families, youth, when we're not seeing them in person is pretty difficult. That goes along with that tech access issue. Not having enough capacity in healthcare. The needs that everyone's seeing right now are going to continue after funds will expire in December. And echoing what other people have said as well, just a need to know who's doing what and what their current capacity is like at this exact moment, whether it's a dashboard or just some kind of knowing what's out there at this exact moment. Anyone else feel free to jump in if I missed anything.
I think that was wonderful, though. Thank you, Alicia. I mean, it seems like we do have a little bit more consensus. I would like going into this, I didn't know because of our varied sector if we were going to all jump into the same stuff, but I think we're moving into some goals that look like they would work for everybody. And the goal is to keep the entire committee engaged in this process. So we want you to stay engaged. So we want to make sure that the goals we choose benefit your organization, right? So I think next steps would be then, Janet, you want to jump in?
Just real quick, we did have 5 groups. If we have time for group 5 to just quickly say something. I knew that's what had happened, Eli.
It's just time for more caffeine. Sorry, y'all. Okay, come on. Yes, group 5. Yes.
I was in group 5, so I'll make it real short then. We talked funding, access, coordination. We did talk about the lack of safe transitional housing that provides wraparound services, and that we in general are relying on people to come to the service as opposed to the service coming to the people.
Right.
That's a very brief nutshell.
That's a good way to say it.
Nice.
Is that in the note? Good. Okay, good. I like the way that was done. So it sounds like to me, then the next steps would be for us to send out a summary and then work on building a consensus in terms of goals. Is everybody okay with us having that stated deadline of Friday, a week from tomorrow? Beautiful. Thank y'all for your time. I know how precious it is.
Absolutely. And if I could just add again, thank you. Thank you for joining, for participating in this group and valuing the importance we do. And so we're committed to working with you to help you to get to where we need to go. Thank you again. Enjoyed spending this afternoon with you.
Yes. Thank y'all. I'm looking forward to let's get it done.
Yeah.
Okay.
Bye.
Thank you, everybody, for your commitment and efforts. Thank you, Eli and Judy.
Thank
Thank
you.
you. Goodbye.
Thank you.